Have you ever heard of someone who went to bed feeling perfectly fine, only to wake up in the hospital after a stroke? It sounds shocking, but it happens more often than you might think. And here's the part that most people never consider: sometimes, the hidden trigger is as simple as the way you sleep. Yes, your sleeping position, the posture you hold for 7 or 8 hours straight, can quietly increase your stroke risk overnight. Most of us assume strokes are only about high blood pressure, diabetes, or smoking. While those remain the major causes, research shows that even how you rest your head and neck can affect oxygen flow to your brain. That's why today we're looking at the safest and riskiest sleeping positions for seniors, backed by Harvard, Mayo Clinic, Cleveland Clinic, and the American Heart Association. If this matters to you, don't forget to like, share, and subscribe. Stroke risk beyond the usual causes. When we think about strokes, most of us immediately point to the big culprits: high blood pressure, diabetes, smoking, or heart conditions like atrial fibrillation. And that's absolutely correct. Those are the leading causes, no question about it. But here's something that doesn't get talked about enough: the way you sleep each night can quietly influence those risks too. Now, to be clear, your sleeping position alone won't cause a stroke. But it can set the stage by making two hidden problems worse. The first has to do with something called obstructive sleep apnea. This is when your airway gets blocked during sleep, causing you to stop breathing for a few seconds at a time. It might not sound serious, but over hours each night, this means your brain is repeatedly starved of oxygen. Sleep apnea is already a well-established independent risk factor for stroke, and certain positions, like lying flat on your back, can make it significantly worse. The second hidden issue involves blood flow. Think about it: if you hold your neck twisted or compressed for hours, or if your body is bent in an awkward position, you can actually reduce circulation to the brain. Over time, this can strain the blood vessels, pinch nerves, and increase pressure on arteries that are already vulnerable, especially in older adults. So while the major causes of stroke remain the same, how you position yourself in bed every night can either reduce or magnify those risks. That's why it's so important to understand which positions protect your airway and circulation, and which ones silently put stress on your brain while you sleep. Sleeping on the back, pros and cons. Let's talk about one of the most common sleeping positions: lying flat on your back. On the surface, this position sounds ideal. It keeps your spine in a neutral alignment, which can ease back pain. It prevents pressure points, reduces the chance of waking up with stiff joints, and, believe it or not, it even helps reduce facial wrinkles since your face isn't pressed against a pillow all night. For younger adults without health issues, back sleeping can be perfectly fine. But for older adults, especially those who snore heavily or live with sleep apnea, back sleeping can quietly become dangerous. When you lie flat, gravity pulls your tongue and the soft tissues of your throat backward. That narrows your airway, making it harder for air to pass through. As a result, your oxygen levels can drop again and again during the night. Every time that happens, your blood pressure fluctuates, your heart works harder, and your brain receives less oxygen than it needs. Over months and years, that pattern raises your risk for serious problems, including stroke. Harvard experts warn that for people with sleep apnea, continuing to sleep on the back significantly raises stroke risk compared to other positions. That's why this posture is only considered safe if you don't have apnea or major snoring issues. If you do prefer back sleeping, there are safer ways to do it. The key is pillow choice. A pillow that's too thick will push your chin toward your chest, while one that's too flat will let your head fall back, straining your neck. The sweet spot is a medium-height pillow that supports your neck's natural curve without tilting it forward or arching it back. Sleeping on the side, the safest position. Now let's move to what experts from the Cleveland Clinic and Mayo Clinic agree is the safest choice for older adults: sleeping on your side. This position offers a balance of comfort and protection that other postures simply don't match. When you lie on your side, your airway stays more open, which means fewer pauses in breathing, less snoring, and reduced strain on your heart and brain. For people with sleep apnea, this simple shift can dramatically lower nighttime oxygen drops. Side sleeping is also a friend to your digestive system. Lying on the left side in particular helps prevent acid reflux because gravity keeps stomach acid from creeping up into the esophagus. But the benefits go even deeper. Recent studies suggest side sleeping may enhance your brain's glymphatic system. That's the natural cleaning process that flushes away toxins and waste products while you sleep. A more efficient cleansing system may help protect memory and reduce the risk of cognitive decline with age. Of course, no position is perfect. Many people curl up too tightly into a fetal posture, which can restrict breathing and stiffen joints. Others tuck an arm under their head, which often leads to numbness, shoulder pain, or tingling fingers in the morning. The good news is these problems are easy to fix. A body pillow can support your posture and prevent you from rolling onto your stomach or back. Placing a small pillow between your knees keeps your hips aligned and reduces pressure on your lower back. And finally, using a properly sized head pillow helps your neck and spine stay straight without bending forward or arching back. Simple adjustments like these can turn side sleeping into the most protective and restorative position for seniors. Sleeping on the stomach, why it's high risk. Some people swear by stomach sleeping because it seems to quiet their snoring. And yes, lying face down can reduce airway noise. But here's the trade-off. It introduces a whole new set of risks, ones that are especially serious for older adults. Think about what happens when you sleep on your stomach. To breathe, your neck has to stay twisted to one side for hours at a time. That unnatural rotation puts constant strain on your cervical spine, the delicate structure that supports your head and protects vital nerves. More concerning, it can compress the vertebral arteries. Those are the blood vessels at the back of your neck that supply oxygen to your brain. In rare but documented cases, this prolonged twisting has been linked to strokes in stomach sleepers. The risks don't stop there. Many stomach sleepers also end up in what's called a twisted position, where the upper body faces one way while the hips and legs are angled another. This contortion stresses the spine, pinches nerve roots, and interferes with smooth blood circulation. You may not feel it while you're asleep, but your body pays the price in stiffness, numbness, and poor oxygen flow by morning. For seniors, these dangers are magnified. With age, many people already have some degree of spinal degeneration or hardened arteries. Combine that with the extra pressure from a stomach-down position, and the risks escalate. Instead of protecting your health, you may be quietly putting strain on some of your body's most vulnerable systems. That's why most doctors and sleep experts recommend avoiding stomach sleeping altogether, or at the very least, breaking the habit slowly with the help of supportive pillows that keep you comfortably on your side. Warning signs your sleep position is harming you. Most of us think of sleep as the time when our body fully rests and heals itself. And while that's true, the way we position ourselves during those long hours can sometimes cause more harm than good. The tricky part is, your body may be giving you signals every morning, but they're easy to brush off as just getting older. In reality, these symptoms can be important red flags that your sleeping posture is quietly undermining your health. One of the most common warning signs is numbness or tingling in the arms or legs when you wake up. Many people laugh this off as a limb falling asleep. But in truth, this usually happens because nerves or blood vessels were compressed for too long while you slept. When your neck is twisted awkwardly or when you've been lying on one arm, circulation gets restricted. Over time, that kind of nightly pressure can contribute to nerve irritation and reduce blood flow to the brain. What seems like a minor inconvenience may actually be your body's way of telling you that something isn't right. Another sign to watch for is dizziness when sitting up in the morning. If you've ever felt lightheaded as you move from lying down to standing, it's tempting to blame dehydration or low blood sugar. But sometimes the real culprit is your sleeping position. If your neck has been compressed or bent in an extreme angle for hours, the blood flow to your brain may have been compromised. When you suddenly shift positions, that reduced circulation can trigger a wave of dizziness. For seniors especially, this isn't just uncomfortable, it can be dangerous, because dizziness in the morning raises the risk of falls. Then there's the issue of morning brain fog or headaches. Many older adults chalk this up to aging, but it often has more to do with how your body is positioned at night. These are hallmark warning signs of sleep apnea. When you sleep on your back and your airway narrows, oxygen levels drop and your brain struggles to get the fuel it needs. The result? You wake up groggy, unfocused, and sometimes with a pounding headache. This is not normal aging, it's your brain sounding the alarm that it's been deprived of oxygen. The most important takeaway is this: these warning signs are not just random annoyances. They are subtle but powerful reminders that your sleep position may be harming your circulation, your nerves, and your brain health. Dismissing them as just part of getting older can be a costly mistake. Instead, treat them as signals to reassess how you sleep. Pay attention to your posture, your pillow setup, and your body's feedback. A few adjustments, like shifting to your side, keeping your neck in alignment, or using a supportive pillow, can make the difference between waking up refreshed and quietly adding to your stroke risk night after night. Best and worst sleeping positions for seniors. So, let's quickly recap the best and worst sleeping positions for seniors. The gold standard is side sleeping, especially on your left side. This position keeps your airway open, reduces snoring, lowers the severity of sleep apnea, and even helps with acid reflux. Plus, research suggests it supports the brain's natural cleaning system, which may protect memory and reduce the risk of cognitive decline as we age. Back sleeping can be acceptable, but only under certain conditions. If you don't snore heavily or suffer from obstructive sleep apnea, lying on your back can help keep your spine aligned and reduce joint strain. Just remember to use a medium-height pillow that supports the natural curve of your neck. On the other hand, stomach sleeping and twisted positions are best avoided. These postures strain the spine, compress arteries and nerves, and interfere with healthy circulation, risks that increase as we get older. The key rule to remember is simple: keep your neck and spine aligned, and make sure your airway stays open. That combination not only helps you sleep more comfortably, but it also protects your brain and overall vascular health night after night. Sleep, brain aging, and cognitive health. Sleep isn't just about feeling rested, it's one of the most powerful tools your brain has to protect itself as you age. After the age of 60, the brain's glymphatic system, a natural cleaning network that flushes out waste and toxins, begins to slow down. This system works most effectively while you're asleep, and it's especially active when you lie on your side. That's one reason experts recommend side sleeping as the best position for brain health. But when your posture is poor or your sleep is fragmented, that cleansing process is disrupted. Over time, waste proteins like beta amyloid can build up in the brain. This substance is strongly linked to Alzheimer's disease and other forms of memory decline. In other words, the way you sleep tonight can influence your cognitive health years down the road. Sleep duration also plays a major role. The sweet spot for older adults is 7 to 8 hours each night. Too little sleep leads to oxidative stress, higher blood pressure, and reduced resilience against disease. On the other hand, sleeping too much is not harmless. It's been associated with cognitive decline, depression, and even higher mortality. But here's the key point: quality matters more than quantity. It's not just about clocking hours in bed, it's about reaching deep, restorative stages of sleep where your brain repairs itself, clears toxins, and consolidates memories. So, For seniors looking to stay sharp and protect their brains, the formula is simple: aim for 7 to 8 hours of sleep, prioritize side sleeping for better brain cleansing, and make sure your sleep is truly restful. So here's the bottom line: the way you sleep each night matters more than most people realize. Choosing the right position can protect your brain, support circulation, and reduce your risk of stroke, while the wrong one may quietly strain your body for hours at a time. For seniors, the safest and smartest choice is to sleep on your side, preferably the left. Back sleeping is acceptable if you don't suffer from sleep apnea, and with the right pillow support. But stomach and twisted positions? Those are best avoided. Remember, keep your neck and spine aligned, keep your airway open, and aim for 7 to 8 hours of deep, restorative rest. That's one of the simplest, most powerful ways to safeguard your health as you age. Now I'd love to hear from you. What's your usual sleep position? Share in the comments, and don't forget to like, share, and subscribe for more trusted health insights.